So today is a wonderfully busy day at South Florida Integrative Health Center. We have our functional medicine and integrative medicine that we're individualizing for each person that comes to our center. And the blood tests that we run are looking as well as the normal blood test, but we're trying to pick up on inflammation and problems with methylation because we know that that is involved with detoxification. And so we are working really on the micronutrient level, microbiome level, neurotransmitter, and of course hormones and electrolyte level. So we begin with each patient to know body composition, a very accurate body composition. The person should be lying flat so the fluids are balanced. And we use electrodes like similar to the same ones with used with an EKG, so it's more accurate. We're not holding a device with our hands, which can be calloused or sweaty, or our feet, which also can have barriers. This is on the soft tissue up the arms and the legs, and it sends an electrical signal to show resistance through the fat and the muscle. So we know exactly how much fat, how much muscle. There should be a relationship between the two. We're not just looking for percent body fat. We're looking for exact amount in pounds to the tenth of a pound, exactly how much fat, how much muscle. And we can also see whether the water that a person is drinking is, first of all, enough, sufficient. We should be 55 to 60% total body water. And this report, which is just the first page, will tell us how much total body water and how much the total body water is right here. And right here is 45%. It's too low. We want to be 55 to 60% total body water. Intracellular, it's broken down even more. What's inside the cell and outside the cell, it should be approximately a 60-40 ratio. In this case, it's 51.9 to 48. There's too much water outside the cell. That is indicative of inflammation and the cell membrane not being receptive with electrolytes or fatty acids. That needs to be corrected and balanced, and that's what we do here. This is our starting point. Again, something so important, you're going to hear more about it in the future, is phase angle. That is using the same electrical signal, but it shows the vitality of the cell membrane, how well that cell membrane is holding on to that electrical charge. That is phase angle. And there was a large NHANES study, which is a large nurses study of thousands of nurses, where they showed the phase angle using the same device that I'm using, which is, again, lying flat, using electrodes. It's repeatable. In other words, each time you do a reading, it's going to be accurate, repeatable, not like the ones that you hold with your hands or you step on with your feet, where each time you step on it, you get a totally different number. You really want to know how accurately how much water is inside the cell, so we can work on that, keep you hydrated. That's how you're going to get rid of toxins, is with proper hydration. That's just the first step. We are looking, when we do the labs, a lot of our lab reports are, again, looking for inflammation. We do high sensitivity C-reactive protein. We're running a homocysteine because it lets us know how a person is methylated, which is leading then onto inflammation, and it is a marker. There has been studies showing that high homocysteine increases endothelial the lining of the arteries. It causes more inflammation with a higher homocysteine. It's been associated with Alzheimer's and cardiovascular disease, but we run it here to see if there's a need for certain B vitamins and to improve methylation. And we do actually improve homocysteine by improving methylation. We've had a patient recently who had an 18 homocysteine, very high. In functional medicine, we want the homocysteine to be about 8. And we've gotten it down to now 7.7 over a few months of using methylated nutrients. And if you look here, we have a report that actually shows the nutrients, because we also do vitamin and mineral testing. So this is methylation. You see, as you look at it, there's going to be the methylation that occurs with dopamine and norepinephrine, the catecholamines, that uses these co-nutrients such as B6. You can see the different vitamins that we're looking to improve methylation, to improve dopamine and norepinephrine. The balance of it is going to need these cofactors, these co-nutrients. Some of them are amino acids, but like tyrosine, and that's going to improve the dopamine part of the methylation cycle. As you see, the middle circle there is the folic acid. We all are familiar with that. That is really responsible for our DNA, the health of our DNA, which is so important with aging. And look what's involved with folic acid. Methylation requires so many different other vitamins like B2 and B6, the activated forms of those vitamins. And the third circle over here is the detoxification part of methylation, because eventually it's going to work its way down to homocysteine, to glutathione, which is what we want. That's our major detoxification amino acid, part of our liver detoxification P450 system is glutathione. We want the methylation to make it all the way down to glutathione here, and not stick around and build up with a high homocysteine, because there's none of these co-nutrients such as vitamin B6, cysteine, selenium is another one, and we have magnesium. This is how we're using nutrients to balance methylation. And we all know about the mitochondria and how important that is for our cellular energy. So the same nutrients are going to be, or in addition with others, are going to help us. This is how we get energy. This is how we move. This is why we need, at times when we're stressing our system, we're undergoing not a perfect oxidative phosphorylation, which is aerobic metabolism, and there are byproducts coming off which we can measure in the urine based on not having sufficient amount of these cofactors. Again, why nutrients such as vitamins, minerals, amino acids such as alpha lipoic acid, carnitine, CoQ10, B2, B6, riboflavin, and thiamine, all important, magnesium, zinc in this cycle. Our labs are going to have optimal values, not just a range. We're looking for optimal values. Our TSH, for example, is not going to go from 0.5 to 4.5. The optimal TSH in functional medicine is somewhere around 1.25 to 1.5, certainly not much higher than 2. So that's the difference between an optimal range and a reference range. At times, based on symptoms, we are looking for foods that are causing inflammation. As you can see, there are certain foods shown here in the red. This is a highly accurate blood test looking for not only antibody response, which is what most of those food allergy, food sensitivity testing is looking for. We're looking for inflammation. So so you don't get as many foods coming up, because it's not just about antibody production, it's about inflammation. That's very important, especially if someone's having certain subtle symptoms such as bloating, constipation, even stomach cramping, eczema, running nose, congestion, especially a few days. These are delayed sensitivities leading to inflammation. We want sometimes to heal the gut, to rest the gut, and we do that by avoiding those foods that came up in the red, and there's orange and yellow. Those are the top three. As you can see, in this case, the reds here, it happens to be wheat gluten and whole wheat, and there's the orange. The second level of inflammation is casein, which is the protein in milk and cow's milk. And our wonderful GI stool test, which uses DNA technology, the microbiome, as we all are hearing about, is involved with inflammation, immune system, our endocrine system, and our neurotransmitters, is so important. And this test is looking at opportunistic bacteria, It's broken down to have autoimmune triggers. Some of these bacteria, like Proteus and Klebsiella, are autoimmune triggers. And of course, Candida in the blood can cause lethargy, tiredness, bloating. We are looking for H. pylori, and this is our good bacteria that can sometimes be too low. If some of these bacteria are too low, like Clostridium, it won't produce short-chain fatty acids, which are now known as a postbiotic, meaning that is a necessary nutrient, a short-chain fatty acid that actually feeds the brain as a quick source of energy. Very important. So functional medicine gets to the root cause, and we provide solutions based on very extensive testing and listening to our patient's story, our patient's health history. How did they get to this place now in their health, and how can we take it to the next level? Everyone have a wonderful, healthy day.